If you or someone that you love or you help take care of loves to take an over-the-counter pain medication, something like ibuprofen, which has brand names Advil and Motrin, or something like naproxen, which has brand name Aleve, or any other anti-inflammatory pain medication, then this video is for you. And please stay to the end because I'm going to tell you one combination that can quietly just wreak havoc on your kidneys. And I see this all the time in our clinics. And it's something that is common for people to be on, but it's not monitored the way that I feel like it should be. So I want to talk to you about the drugs first, and then I will tell you about that combination at the end, because a lot of people are on it and they don't realize what they could be doing that's making it worse or that could make it better. Now, quick story. I was talking to a patient and I remember them saying something like, oh, I'm just taking ibuprofen. I take it pretty much every day to help with my back pain. And I'm telling them, like, just be cautious with it because although it is over the counter, you still have to monitor it. And this wasn't a personal patient of mine. It was someone who was more in a community setting that I was talking to. So I wasn't able to see like all of their labs and all of the other, medical medication things related to this person. But then a few weeks later, I saw them at church and they were telling me how their blood pressure started creeping up. Their ankles were getting puffy. And we were just having like a conversation around like, how are they feeling? So then I'm like, well, let me see your labs. And I noticed that the last few kidney labs were starting to kind of creep up as well. And this is an indication to me that their kidneys are under stress. And it's one of those things that people don't really talk about a lot because they don't think of ibuprofen as like a serious medication, but I want to talk about it. But before I get to that, my name is Takova. I am a clinical pharmacist as well as a medical educator. I work in the primary care setting, and my goal here on this channel is to teach medications in plain language so that you can feel confident and safe when it comes to how you take your medications. And also, if you want my free medication mind map guide, it's a way to really think through your medications, conceptualize them so that you really truly understand them and what you're taking and putting into your body. Then go ahead and grab that free guide. It's in the description box. And hit the subscribe button because I post videos like this every week. Now, let's talk about NSAIDs like ibuprofen and naproxen. These specifically work to turn down your body's alarm system for pain and swelling. So like when you sprain an ankle or have a bad toothache or cramps or arthritis or a sore back, then your body releases a lot of little chemical messengers that say swelling is here, pain is here. And NSAIDs essentially kind of lower the volume on those messengers so that you feel less pain. You may have less swelling in those areas, and those areas also feel less warm to the touch and they're less irritated. Now, inside of our bodies, there's a process that makes something called prostaglandins. And prostaglandins are like pain and inflammation signal boosters. So NSAIDs are going to block the step so that your body makes less of those prostaglandins or those pain and swelling boosters. And of course, NSAIDs are going to work best when you actually do have inflammation or your pain has a like inflammation kind of flavor to it. So again, things like sore knees or hips from arthritis, a twisted ankle or sports injury, even like period cramps, because the uterus does use some of those same signal boosters, tooth pain or jaw pain, some headaches, not all of them, but some headaches, especially if they kind of feel like there's a pressure to them, those can be tied to inflammation for some people. So if you're thinking about, NSAID versus acetaminophen, think NSAIDs, pain plus swelling or inflammation, and think acetaminophen or Tylenol if you have pain and fever, but not so much for swelling. Now, NSAID specifically can feel like this magic swelling relief because they are going down that pathway that blocks those prostaglandins. But one thing to consider is that same process is also, those prostaglandins and other things that are made in that process are also helping with your stomach, and they have benefits for your kidney. So if we're blocking that, then now we may lose some kidney and stomach protection. So the trade-off then is that these medications can irritate the stomach lining. They can tighten blood flow to the kidneys and make your body hold on to salt and water, which for a lot of people, we do not want that. So then we get things like stomach pain, ulcers, heartburn, even increased risk of bleeding. And then your kidney function can worsen as well, which is what I was seeing in that specific community member that I was talking to. Because you're holding on to more water and sodium, then you may see more fluid buildup. If you're someone with high blood pressure, your blood pressure is going to go even higher. And so we see swelling and increased blood pressure. And then specifically for people who have heart concerns, it can be risky to even take NSAIDs. So just be very cautious and talk to your healthcare practitioner about it. But if you've got any type of heart disease, but especially heart failure, then you want to talk to your healthcare practitioner and just either not take it or not take NSAIDs at all, or be very sparingly with them. Now, if you have ever had a stomach ulcer, a GI bleed, if you have or have had kidney disease, again, heart failure, uncontrolled blood pressure, if you're on blood thinners like warfarin, Xarelto, if you are pregnant, especially later in pregnancy, then you definitely want to talk to your healthcare practitioner before taking anything over the counter, and definitely before taking any of these NSAIDs over the counter. Generally speaking, when using these NSAIDs the right way, the lowest dose, the shortest amount of time, they can be a really great tool for short-term pain and inflammation. Now, if your pain is more inflammation than anything, if it's lasting for a long time, then you might, again, want to go to your healthcare practitioner, because you might need something a little bit stronger. They may put you on a steroid taper for a while, or you might need to fix some underlying issue that you could be covering up with this over-the-counter pain medication that you're taking every day. And I also like to really get people's mental frame in mind, because you think that the pain medication is going to completely take your pain away. And that's not always the case. Actually, that's not often the case. It's going to lower or reduce your pain significantly, but that pain will likely come back, especially if the underlying issue isn't corrected. But even if it is corrected and you've just got some dull underlying achy pain, you may still be dealing with that, and it may not completely get rid of the pain overall. Now, I want to talk about drug and drug-food interactions. This matters because insects love to interact with other medications. They don't really have a lot of food interactions, but when it comes to medications, I already kind of mentioned, but blood thinners. So Eliquis, which is, and Xarelto and warfarin, which are blood thinners that are used, or anticoagulants that are used for if you have AFib and you're at an increased risk of having a clot, or if you've ever had a clot in the past, you may be on one of these. And so then starting an NSAID is going to increase your risk of having a bleed in someone who we are reducing their clot risk, which means we are already increasing your bleed risk when we put you on one of these medications. So again, doesn't mean you can't take the NSAID. It just means that you need to do so cautiously and make sure that you talk to your healthcare practitioner. And then if you are getting something like a steroid, like prednisone, and you also take an NSAID, you're going to be at a higher risk of ulcer or bleed. Now, this is really interesting because just the other day, my neighbor called me over, and she'd been having some hip pain due to a prior surgery, and they gave her a steroid taper at the doctor's office. And she was asking me, I'm in pain right now. I took my first dose of steroid this morning, but I'm in a lot of pain. So I talked to her about potentially taking Tylenol as a, initial dose while the steroid kicked in, or taking one dose, no more than 2 doses of a low dose NSAID. Normally, we're not going to have you taking NSAID and steroid continuously together, but that steroid can take a day or so to really kick in and start to work. And so I'm like, you could potentially take 1 dose of that NSAID, a low dose, and that will work a lot quicker while that steroid is starting to do its job. But again, keep in mind that steroids plus NSAIDs together are going to increase your risk of having an ulcer or having a bleed. There are also some antidepressants that can increase the bleed risk when paired with NSAIDs as well. So just, again, talk to your practitioner about that and be cautious about what antidepressant you might be taking and whether or not you are at risk if you're taking an NSAID continuously. Now, another big one is if you are taking low-dose aspirin for your heart. Don't casually stack an NSAID without asking about timing or other safety parameters when it comes to taking low-dose aspirin for cardiovascular things that are going on. And then also you have pain and you want to take an NSAID for pain. So just keep that in mind that aspirin is technically considered an NSAID, although we don't really categorize it that way. Clinically speaking, it works in a lot of very similar ways as ibuprofen and naproxen. So you have to be very careful. Right. Finally, some extra special things I want to talk about: dosing. The max dose is a little bit different when you're taking things over the counter versus when you're under a prescription and your clinician is watching you all the time. So I'm specifically going to talk about the max dosing for over the counter. If you need to walk into the pharmacy and get something for yourself, what's going to be the max dose for that? This is important because people can accidentally get themselves in trouble by taking and double dipping in multiple products and not really realizing it. So ibuprofen, most ibuprofen over the counter is going to come as 200 milligrams, and that's regardless of if it's if it's Advil or Motrin. So with that 200 milligram of ibuprofen, you're going to take one tablet every 4 to 6 hours. If you need to take 2 tablets, you can, but start off with one tablet every 4 to 6 hours. And no matter what, do not exceed 6 tablets within 24 hours. And that's going to be 1,200 milligrams per day, max, over the counter. So make sure that you are adding up how many milligrams of ibuprofen you are taking throughout the day. And then when it comes to naproxen, that product, which is Aleve, is usually going to come as 220 milligrams. So one tablet every 8 to 12 hours. And again, you can take 2 tablets for the first dose, but naproxen is a little bit different. I don't want you to exceed 3 tablets in 24 hours. So that's going to be 660 milligrams total daily. All right. Now, with ibuprofen and naproxen, keep in mind, we are concerned about your kidneys. We do not want to overwhelm your kidneys. We don't want to accidentally lead to increased sodium and water retention. We don't want to put extra strain on your heart. So make sure you are not overdoing it or accidentally overdosing on naproxen or ibuprofen. And then finally, just because it matters in the context, we've got acetaminophen, which a brand name is Tylenol. And as I said in all my videos, you do not have to use the brand name. I just say that so that you know what a brand name is for the product. So acetaminophen, brand name Tylenol. Any products that you use that have acetaminophen in it, no more than 4,000 milligrams in a 24-hour period for adults. Some of the products, like extra strength Tylenol, may list a slightly lower max on the label, like maybe 3,000 milligrams. But generally speaking, no more than 4,000 milligrams per day. Now, this is important because, again, stacking. So you might be on excuse me for my sniffle, but you might be on like a cough and cold or cold and flu medication. A lot of those have acetaminophen in it. Or you might be taking something like Tylenol PM to help you sleep. Keep in mind that all of that Tylenol that you're taking throughout the day should not exceed more than 4,000 milligrams. We have to make sure that we are being very cognizant about how much you are putting on your liver to do the work of breaking down this medication. And when you have too much of it in your system, the liver is overwhelmed. It cannot break it down. Now we have toxic metabolites or toxic breakdown components of Tylenol that can't be cleared. And now we have issues. So make sure that you are not taking too much of acetaminophen throughout the day. If you have an upset stomach while you're taking any of these medications, usually you can take it with food, or you might want to avoid daily use for a while unless your clinician is monitoring you and telling you to take it. So just be cognizant of that if you are having some stomach or GI issues. Now, if you need something that's a safer alternative to an NSAID, you can always use acetaminophen. It's going to be safer for your stomach. It's going to be safer for your kidneys. And again, you just have to stay within the daily recommended limits and try not to mix it with alcohol. Or if you already have liver disease, try not to take it or talk to your professional about how much you can take. If you have liver disease, usually we're going to have you stay away from it just because your liver is not going to may not be able to handle the acetaminophen. But generally speaking, if you're having issues with an NSAID, or if you cannot take an NSAID like ibuprofen or naproxen, then you can take acetaminophen. And then there are also times when, if we don't want you to take a lot of an NSAID, then we'll have you take 1 dose of an NSAID, and then maybe like 4 to 6 hours later, take Tylenol instead, and just layer it like that so that you're not having to take the NSAID as often. But that's something that you can talk to your pharmacist or your personal clinician about. Now, here's the big issue that I see a lot. And I want to be clear that this is something that is a huge pet peeve of mine working in primary care. If you're on blood pressure medication like lisinopril or losartan, and you're on a water pill like HCTZ or furosemide, which is very common to be on like losartan and HCTZ, then adding an NSAID like ibuprofen to that can be a perfect storm in an imperfect way for your kidneys. We call this the triple whammy. It's when you have a blood pressure pill med like losartan, plus a water pill like HCTZ, which is also used for blood pressure, plus an NSAID, and that can lead to the kidneys getting very stressed fast. So if you notice any new onset swelling, if you're peeing less, if you're more dizzy than maybe you feel like is normal, or if your blood pressure suddenly gets worse, please do not ignore it. make sure that you talk to your provider, because this could mean that your kidney function is worsening, because we've got these different medications that are working on the input and the output from the kidneys and squeezing on those, and it's building up pressure on the kidneys. And we don't want to do that. Blood pressure med like losartan, plus a water pill like HCTZ or chlorthalidone or furosemide, even spironolactone I'll throw in there, plus an NSAID like ibuprofen or naproxen. Then make sure that you are being very cognizant of your symptoms and your kidney function, and make sure that you're asking questions to your healthcare practitioner about that as well. Now, again, hopefully this was helpful. Grab the free medication mind map in the description box. I really think it will be helpful to help you just really organize your medications, what each medication is for, what's its specific mechanism of action, what are some side effects to watch out for, some questions to ask, which provider is giving it to you, and just to write everything out and see it in one place is really helpful. Science tells us that. So it's worth a shot. Try it out. Help keep yourself organized and show up like the CEO of your medications. Thanks for watching. Please subscribe.